There we go. Medical apartheid. We're continuing to read um, from the chapter dealing with eugenics and dealing with birth control and dealing with all of that. Because basically dealing with black women and what's been done to them. Such effects drove 1 in 3 women implanted with Norplant to seek its removal within the first year. 3 years later, half had sought its removal. But women who decided that Norplant and its myriad health hazards were not for them often found themselves tethered to the contraceptive, because although Medicaid eagerly preferred the cost of inserting Norplant, it was less forthcoming with the $500 removal fee. Norplant was the subject of a recall in 2000 and it was taken off the market in July 2002. By the latter half of the 1990s, another physician-mediated long-term contraceptive had appeared to replace Norplant in low-cost clinics in African American schools. The Depo-Provera injection, despite its checkered past as an FDA-condemned carcinogen, in 1991, 27-year-old Darlene Johnson's judge made her an offer she could not refuse. The California mother of 4 had spanked her 6-year-old daughter with a belt and an electric cord for smoking a cigarette. And her 4-year-old got the same punishment when Johnson caught her inserting a wire hanger into an electric outlet. Beatings. Now Johnson was frightened. She had pled guilty to 3 counts of felony child abuse, was facing prison time, and was 8 months pregnant. Enter Judge Howard Broadman, who offered her a choice of 7 years jail time or 1 year in jail and 3 years probation if she agreed to Norplant insertion. Johnson asked whether it was safe, and Broadman assured her that it was and could easily be removed if she experienced difficulty. Johnson agreed, but when she discovered that Norplant is contraindicated in women like herself who suffer from diabetes and hypertension, she changed her mind. Although the ACLU and even the district attorney joined her lawyers in urging Broadman to release her from the agreement, he would not. Ultimately, Johnson was jailed for violating her probation by using drugs. This rendered her case moot, but not the window it opened into the coercive use of contraception and sterilization by the legal system. During the 50 years since eugenics' heyday, the American courts have upheld procreation as a legally sacred civil right. In a 1942 decision, for example, the Supreme Court rejected the Oklahoma law allowing the sterilization of people who were convicted of multiple felonies involving moral turpitude. Yet black women's fertility and their right to refuse medication is treated differently. Many Darlene Johnsons exist, nearly all of them black like her. Black women who abuse drugs are 10 times more likely than white women to be subjected to court-ordered long-term contraceptives and sterilizations. Forced contraceptive use in response to allegations of child abuse is punishment, not therapy, because it does not protect the existing children as counseling would. It delays, not prevents births for the duration of the Norplant sentence. In any event, preventing a child's birth is a draconian method of protecting it from abuse. In 1994, the Center for Reproductive Law and Policy in New York City accused the Medical University of South Carolina in Charleston of illegal drug testing and illegal human experimentation. According to a complaint filed by the National Institutes of Health, the hospital tested poor black women who had voluntarily gone to the hospital to seek prenatal care for drugs without their consent, then reported those who tested positive to the police. Between 1989 and 1994, approximately 40 of these women were arrested. Some of them gave birth while shackled to their hospital beds. U.S. Department of Health and Human Services Civil Rights Director Dennis Hayashi mounted a civil rights suit because all except one of the prosecuted women were black. The sole white arrestee, as her nurse noted in her medical record, lived with her boyfriend, who is a Negro. That's what the nurse wrote. Yeah. South Carolina. That's it. Funny, I got that shirt on now. Um, the hospital also conducted illegal research with these women. This selected arrest and prosecution of black women an insidious national pattern, according to Zita Lazzarini, JD, MPH, Director of Medical Humanities, Health, Law, and Ethics Program at the University of Connecticut School of Medicine. 86% of women prosecuted in jails for drug abuse while pregnant were black. A 1993 study of women whose offspring had been exposed to cocaine prenatally found that black and Latino women were 72% more likely than white women to have their children removed by Child Protective Services. Public clinics in urban settings test and report more vigorously than do private clinics, and this helps drive the racial disparity. However, contrary to media representations, black and white women abuse drugs at the same rate. So one would expect equal drug abuse rates among pregnant black and white women, and this is the case. Several studies, including a 1990 New England Journal of Medicine report, found no significant racial difference in drug use between pregnant black women, 14.1%, and pregnant white women, 15.4%. But these studies indicated that black women were 10 times more likely to be reported to law enforcement officials. All right. And I showed my shirt to say I have a degree from the University of South Carolina, so I know what it's like. I know what it's about. Um, Medical apartheid, and still I'm asking, why do black women trust doctors so much? Why do they trust healthcare so much? And another thing, black women, if you think that you can go to a healthcare facility and simply complain and make the quote unquote make the nurses do their jobs, and that's going to help you combat this, you're living in a fantasy world. You really are. Deep. So there you go. Medical apartheid. I think I have one more section to read, and then I'm going to move on to another book. Until next time, stay safe, stay sane.